Many patients, either on their own or from an outside physician, after complaining of a slew of symptoms, are told that it's their hormones. That's a very generic statement. And when a patient who is female is told that it's your hormones, most people are implying that it's your female hormones. So really and truly, there are a lot of hormones that can be involved with a lot of these symptoms. Many of them have the same symptoms. So you kind of have to figure out exactly what's going on. You don't want to miss one problem because you're just assuming that it's your female hormones. First thing I think of when a patient comes in and they're making complaints that they think could be their hormones is what age are they? Based on their age, I will actually consider a different list of hormone choices and the symptoms that come along with those. Now, of course, we're always considering estrogen and progesterone, but the other main players that we're often thinking about, thyroid hormone, testosterone, and some less common players, maybe insulin, DHEA, DHES, androstenedione. When a patient presents to my office, first thing I listen to are the list of symptoms that patient has. I take into consideration what age range they are. And some of the most common symptoms that we'll get in a gynecology office are abnormal bleeding, mood swings. Those are always fun to talk about. Trouble with weight loss, weight gain, hot flashes, fatigue, skin changes such as dryness, hair changes, either losing hair or even developing too much hair. There are just so many different symptoms that they can present with. And when we get that list and look at your age, first thing we do is try to put a puzzle together. We figure out what are the most common causes of the symptoms you're having, and then that leads us to figure out what labs we need to draw. As your gynecologist, I want to work with you to figure out if your hormones are a player in what's going on. Many times we can't figure that out at your first visit. So the first visit is probably more about doing history and physical and figuring out what tests need to be done to determine exactly what's going on. And again, based on your age, there may be something going on now that may change in 3 months, in 6 months, 5 years. So it's a good chance to get to know your doctor. Your doctor can get to know you, and you kind of work through all these problems together.